Now we know that time-limited therapy with the CD20 antibody obinutuzumab and venetoclax induces MRD undetectable responses in a high proportion of patients, and there's strong rationale to add the BTK inhibitor Zanubrutinib to this combination. So we initiated this study really to determine whether MRD-directed time-limited therapy with a bovine regimen would achieve frequent disease eradication as measured by MRD in previously untreated patients. So what are some of the key findings of this study and why are they ultimately significant? Bovine is well tolerated, clearly, notably with a low rate of grade 3/4 neutropenia of just 15%. As a point of reference, grade 3/4 neutropenia was seen in 1/3 to 1/2 of patients in prior studies evaluating venetoclax with a BTK inhibitor. So these data are certainly encouraging, although need additional experience with this combination to see if these numbers persist with larger numbers of patients treated with this combination. Importantly, bovine achieved rapid and undetectable MRD. At a median follow-up of just 11 months, we have achieved MRD undetectable response in the blood in 84% of patients, and in the bone marrow in 73% of patients. So these data are certainly encouraging. Importantly, treatment duration here is determined by a pre-specified MRD endpoint. So patients have to achieve an MRD undetectable response in the blood, have this then confirmed in the bone marrow, and then have this confirmed again in the blood 2 months later. At this point, if MRD is confirmed undetectable at all of these measurements, then patients may discontinue therapy and enter post-treatment surveillance. And at a median follow-up, again, of 11 months, 62% of patients have achieved this pre-specified endpoint and stopped therapy after a median of 8 months on treatment, or just 6 months of the triplet combination. What are some of the potential implications of this work? I think ultimately, what we've demonstrated is that the bovine regimen is well tolerated and that it achieves frequent and rapid MRD undetectable responses. This certainly warrants further evaluation as a frontline regimen in CLL. And by incorporating this MRD-driven treatment duration strategy, we have an opportunity not only to discontinue therapy at what we hope is the optimal duration for a given patient in this phase 2 study, but also to ultimately measure what might be an optimal duration of the bovine regimen for future phase 3 study of the regimen. Our goal being to identify really what is the right amount of time to administer a time-limited therapy of bovine to ensure that we've captured as many of the MRD undetectable responses as possible. This study will have an additional benefit of potentially of identifying really what the value of an MRD-directed treatment discontinuation approach is by following patients after treatment discontinuation and seeing how they do, how durable are these responses. These data will give us some additional information about whether we can use MRD as a tool for determining which patients might benefit from treatment discontinuation.